I'm Teresa Johnson with Senior Care of Sacramento, and we are here with Carol Costa Smith with the Light for Seniors. And we are going to be talking about the different options that are available to seniors to acquire Social Security and Medicare benefits and what the entitlement benefits, federal and state programs are. So, good morning, Carol.
Good morning.
For a senior, what are my options for paying for skilled nursing care?
Well, there's a lot of options. There's government options, and then there's community options, and there's also family options. So depending on a person's individual situation, how their finances are set up and how their family is and their neighborhood or whatever, all of those can be considered in how to provide care.
Start with some of the community benefits.
When I get a call, basically I try and find out what the care needs are and what the care wants are. The care wants would be I want to stay home or I need a facility care. If the option is that the care want is to stay home, there's Meals on Wheels, there's, depending on what county they are in, what the community would provide. Also, neighbors provide care, family provides care. If they own their home, they might want to do a reverse mortgage, especially if they don't have any loved ones to leave their assets to. We look at all of those. What may not be good for one person would be wonderful for somebody else.
Okay. And so it sounds like the community options are, other than Meals on Wheels, which is kind of a state program that provides one meal a day to seniors, it sounds like a lot of the community options are more of a voluntary nature and supported by family and friends. Is that correct? So it sounds like the transportation options are still a fee for those services, though, but they're at a reduced cost. Is that correct?
Right.
Okay.
You know, it's whatever a person needs to stay home. There's, like in San Diego County, they have concierge companies and stuff like that. So non-government companies of good people providing a service that people need, and that would be a community option.
Okay.
Like a placement agency, home care agencies, those are non-government options in the community.
Right. And we help with that. We also narrow those searches down for in-home service and placement. So that's what we specialize in. And so we can help our listeners and readers with those services. Now, what about the government options?
Government options, the main options are Medi-Cal and VA.
And Medicare,
VA,
correct?
They would need to serve at least 90 days active duty consecutively and 1 day during wartime. Not necessarily where the war is, but on the date of the war, and they have specific dates for those. And there's aid and attendance and housebound benefits available for them. The other programs are Medi-Cal, and there's many sub-programs within Medi-Cal, such as in-home support services, also known as IHSS, CBAS, community-based adult services, and those are like daycare. There's a PACE program. That's a program for all-inclusive care for the elderly. And that's where you go and you see your doctors and so on. And then there's just regular Medi-Cal programs. So basically, you need somebody to look at your situation and say, okay, here's an option for your specific need, and you would qualify for these programs, and if we tweak this, you can qualify for these programs. So.
Okay, but that doesn't necessarily mean that these are all free of charge, correct?
Free of charge, what, to apply?
To receive these benefits and services.
If you go for, let's start with VA, they are not allowed to charge you to qualify for benefits. So to do the application, they're not allowed to charge you. If you go to a county veteran service office, Placer County Veteran Service Office, Sacramento County Veteran Service Office, so on, they're supposed to help you for free. There's a lot of county veteran service offices that are not well trained, and they don't do the follow-through, and you don't get very good service, but it is a free service. If you go to a community program that is providing that service for you, they have to get paid somehow. So they'll either get paid by doing annuities, they might charge you for repositioning assets. Sometimes they make it up in volume by helping some people for free and charging others, investing money for others. Or you always have the option of doing it yourself. That's always free also.
But we don't really recommend that because...
We don't recommend that. It is free to do it, but we recommend you go and get help somewhere.
And why is that? Why do we recommend that?
I look for companies, I look for groups that have a procedure. They have follow-through and they're able to track. They have some kind of tracking system for your application. If you do it on your own, you're not going to know who to call to follow your application. They have people already set up, usually if they're good. They could call this person knows how to get that information for you and find your application and find out where it is in the system. If you do it on your own, your application could get lost. You don't know what the rules are. You don't know what to ask for. That's
my experience, and I advise my clients that if you don't know how to cross every T and dot every I, a lot of the applications end up getting rejected for these government and state programs.
Right. They don't call you and tell you we need to fix it. It just kind of sits there until it disappears.
Okay, so that's why Light for Seniors is such good service.
Yeah, the Light for Seniors, we are not certified to do VA applications, and we don't do VA applications, but we do refer out to other organizations that do, and we work with them because 99% of the time, anybody who is doing a VA application would greatly benefit from a Medi-Cal application also. Most people do not know, in the industry do not know, and including VA people, that Medi-Cal and VA can work together. You just can't claim the same benefits. So what we do is we look at the situation, see how to get maximum benefits through Medi-Cal working with VA. So we'll look for both.
And that's my understanding, and that's why I refer to people that can provide the service that Light for Seniors does, and I also refer to VA representatives, and I know that you work with some of them too, hand in hand, and that way you can both be making sure that the client is set up for eligibility for both Medi-Cal, Medicare, and VA benefits so that they're not only having their ducks put in a row and set up for just one of the programs so that they can be eligible to receive all three benefit programs.
Yes. There's different things, too, when I look at if they're trying to stay home and they say, under no circumstances do I want to ever go into a facility, whatever, and maybe we look at reverse mortgage for an option. One of the things I'm going to do is work with that reverse mortgage agent and say, look, make sure you do this and this, and then also work with the family members and make sure that they can still qualify for other benefits so their spend down is less. They can still access their reverse mortgage and use that too. It's just that little thing that keeps them home and also get the other benefits.
Right. And I prefer to use the reverse mortgage as a last option, and I like to see if we can't get the senior set up with other options that are available and resources first and foremost. And I usually like to reserve the reverse mortgage as a last resort. Do you work that way also?
I look at the individual situation.
Okay.
And I rarely refer reverse mortgages. Probably about 90% of the time, I do not refer reverse mortgages. If it fits, it fits. If it doesn't, it doesn't, and you won't even hear that coming out of my mouth. There's usually more things to do than that, but that's just an example I was giving.
Okay, so now what do some of these entitlement benefits cover, such as, can you tell us what's the difference between the Medi-Cal and the Medicare benefits? Because I think there's a big confusion out there for a lot of our seniors.
Okay, Medicare is for somebody who turns 65. They're automatically entitled to Part A. They're given Part B if they do not send back the little card that says they don't want it because they have to pay for that. This year, in 2013, it's $104.90 a month for the Part B Medicare, and everybody should have that. Do not opt out of that. It's going to be a headache if you do. And then there's the Part D drug plan. everybody should have a Part D drug plan. Most people pay for that also. But if they have Medi-Cal benefits, they could also get a free plan.
And how much does the Medicare D supplement program cost as a rule?
The D is for prescriptions, and they're offered by different insurance companies, and they can be anywhere from $20 a month or $18 a month to $75 a month. But if they're zero share of cost Medi-Cal, which means they don't have to pay anything for their medical costs out of pocket before Medi-Cal starts helping them, then they can get the free plan just by calling 1-800-MEDICARE and saying, I want the free Part D plan. And they'll give a list of companies to choose from.
So Medi-Cal and Medicare work together, is that correct?
Kind of. They're starting this new program in 8 counties. It's being launched. Sacramento's not one of them, neither is Placer. San Diego's one of them, San Mateo, LA, Riverside, a few more, Orange. But what they're doing there is they are combining Medicare and Medi-Cal.
These are all in California. This is a state program, or is it federal?
Medi-Cal is a state and federal program that's run by the county, so it encompasses all of them. So each county you would have to apply in. The county provides the employees, but the employees are paid by the state, federal, and county. And the benefits are 50% federal and 50% state.
So there are other states that have certain counties that are designated for this program as well, then. Is that correct?
Right. Medi-Cal is the federal Medicaid program. So in every other state, it's Medicaid. Or they also call it Title 19, the Social Security Act.
But in California, we call it Medicare, correct?
We call it Medi-Cal.
Medi-Cal is the equivalent of Medicaid for other states.
Right.
Okay, but in California, it's Medi-Cal.
Right.
So
and Medicare is the one that you get automatically at 65.
And that's a federal program.
Right.
For every state. Okay. So that clarifies that. So can you tell us, what does Medi-Cal cover and what does Medicare cover?
Okay, so start with Medicare, what everybody gets. Medicare, you're getting your hospitalization Part A, Medicare, and your Part B are the doctor's visits and so on, that you pay per month for that. With an A and B plan, you can get less expensive health insurance. And I can't speak to what the changes are going to be for that with the new laws that are coming around. But the way things are right now, the Medicare program pays for what's called a Medicare Advantage plan. They'll pay something like $500 a month to a doctor, whether they see you or not. And then you pay a small amount to the insurance company, and the insurance company is saying they're going to cover at least what Medicare says they're going to cover. Medicare covers 80% is the normal rule, and 20% is left for the individual to cover. That's where you get the insurance on the market to cover that 20%. So you're either going to get an HMO Medicare Advantage plan, or you can get what's called a Medigap plan that covers that 20%.
Okay, and so does Medicare also cover like durable power or medical equipment, such as walkers and wheelchairs and that kind of thing? Hospital beds?
Yes, with the doctor's prescription, a lot of that is covered through Medicare.
And does it also covers Insure, is that correct? And Depends?
It covers what?
Does it cover Insure, Depends, those kind of supplies?
No, they do not.
So
that's what Medi-Cal will cover.
Okay, and what else does Medi-Cal cover?
Okay, so Medi-Cal is a program that you have to apply for, you have to become eligible for. You have to have, for certain programs, for a single person, $2,000 in the bank, all your accounts added up. You're allowed certain assets like your home and your car and so on. And if you meet these guidelines, then you can qualify for these programs that will pay for incontinence supplies. Your prescriptions would be $1.10 for generic and $3.30 for brand for 90-day supplies. Your Part B Medicare of $104.90 for this year, that's covered. And then if there's any other...
Did you say 140? I thought it was 109.
$104.90.
Oh, $104.90. Okay, thank you.
Some people pay more. It can go up to $140, I think, for the people now that have higher income.
Okay.
But all of that does get covered by Medi-Cal.
If they apply, if they have to apply for that program, correct?
Right, they have to apply for that program. That's why I'm here. A lot of people, when they call Medi-Cal, they're going to be sent an application. They're not going to be asked any questions whether or not you qualify or whatever. You'll have to go through the motions of filling out the applications. Then it's going to go through the system, and you'll probably get a denial. There are denials that people should get and some that are done accidentally. And those, basically, if I'm working on the case, I will know whether or not they're going to qualify, or I will know how to make them qualify before we do the application.
So that's why it's important for them to call you at Light for Seniors, because you can help them determine their eligibility ahead of time. And
exactly. And tell them what benefits they would be eligible for. So if they're saying, I'm going into this facility, and Teresa Johnson's helping me find a place, and I need to know what's available. So I'm going to be able to give them a budget based on them not having a huge out-of-pocket for their prescriptions, their Part B Medicare, that could be added into their rent, and so on.
So basically, by helping the seniors qualify for these programs that are out there, you can transfer the monies that they're now spending for medical bills and prescriptions and insure and doctor's visits and the insurance premiums. All those fees can be picked up by Medi-Cal or Medicare by the senior using your service to help them to qualify and get eligible for those benefits, and thus giving that monies that they're spending for all that can now be used for their care fees, which are generally not covered by Medi-Cal or Medicare if they want to stay at home or go to an assisted living. Is that correct?
That's correct. So basically, I look at their income, I look at their eligibility for VA benefits, and they're out of pocket for, sometimes they have a group health insurance plan through their employer that they're paying $400 a month or something like that. All of that can be redirected to their rental costs for their assisted living or boarding care, really nice place as opposed to skilled care.
Or they could use it to be able to stay at home and pay for an in-home caregiver to come in, correct?
Yes, with in-home care, that's a little different because we have to spend a certain amount down on their income. They have to get below a certain number. This year, for a single person, it's $1,208. So if they have $1,209 income, adjusted income, they're going to be able to live on $600, and the rest of it they have to spend on medical costs before Medi-Cal will help them. I don't know who made this system up, but it hasn't changed since I've been doing this in 2001. It's been around for a very long time. Nobody can live on $600. So what we have to do is basically say, okay, you're working with a home care agency, or how are you getting your extra help? And I need you to spend X amount of money on that kind of care. And then your family members that are coming in and helping out, we can now get in-home support services to cover some other costs.
And when you say the $600 a month has to be spent on medical care, you mean caregivers, correct?
Caregivers, yes.
Yes, not medical expenses that we were talking about, like prescriptions and premiums. We're talking about caregiving.
Right. Well, if they need, we look at the medical insurance first and make sure they get that, and then the remainder of what they need, we say, okay, we're going to have somebody pay you to do certain things, and then we're going to be able to deduct that from the income and then be able to get in-home support services benefits for the family. In-home support services pays about $10.80 an hour. So for the caregiver that's there doing it anyway and not getting compensated, that's a very big deal for them.
Yeah, and it can be paid to family members, correct?
Yes, as long as they're not a child under age 21. Well, let me see. There's different rules and everything. The best thing, instead of me trying to tell you guys how to do it, call me and let me walk you through the process, because The Medi-Cal workers, when I'm dealing with them, they don't know what they're doing. I have to take them through their own manual, fax it to them, and say, okay, this is what we're doing step by step, and walk them through. So,
okay, so
I don't recommend anybody trying to do this on their own. Just hearing this program and saying, this is what I'm entitled to, the worker's going to say, no, you're not.
Okay. So now, I agree, and that's why I definitely refer seniors to get assistance with applying for these programs. Now, you also do asset protection for people who have a more substantial income and maybe a lot of savings and investments. Do you also require, are they also eligible for some entitlement benefits?
Yeah, there are different things we can do with people who are over the limit to get some benefits. There are ways at this time to gift. We can have the money gifted to a family member, and then I like to recommend an attorney or something at that point to set up a trust for them. There's just different things that you can do. Set up a savings account with a sibling and keep each other accountable. There's just different things to do.
It doesn't always have to be a gifting solution. There, like you said, there's other solutions like creating a trust. Or now, if somebody already has a trust, does that mean some people think they're protected? If they already have a living trust, does that mean they're protected?
Well, the revocable trusts that are out there, they're definitely good. But when you're going to qualify for Medi-Cal, Medi-Cal doesn't look at that as a trust as a separate asset. They look at it as if you set up that trust and you have access to that money, you're able to write checks on that trust, then it's your money. So that's added to your countable assets just like any other bank account. So something needs to be done at that point.
So just because they have a trust does not mean they're protected?
It means they're not protected, yes. So
it has to be set up in a certain way. Is that what I'm hearing?
Right. Some trusts can actually be a problem. We've run into situations where there was a revocable trust set up, husband and wife, and the husband became incapacitated, and so his half was irrevocable. Couldn't touch it, couldn't do anything with the house or whatever. It wasn't until after he passed on that we were able to do something with the assets in the trust. So at this point, you would actually need an attorney to look at, if that's a situation, what's available, how can you give the house away or whatever to protect it.
Yeah, so I'm a little confused. I don't understand why attorneys recommend irrevocable trust. Is there a reason why they recommend irrevocable trusts?
Well, an irrevocable trust can be, and I'm not an attorney and I don't give legal advice, but as a non-attorney doing what I do, they have been used successfully the money were gifted to a family member, and then the family member sets an irrevocable trust, not the person who's applying. And then those funds are going to be used for the applicant's care and comfort through their lifetime. That's how that can work.
Oh, but if it's set up in the senior's name, then it's restrictive.
If the senior sets it up.
I see. Okay. So yeah. It could set it up after the fact, but when they are trying to become eligible for the other benefits that are out there. But if it's set up before they get to the point where they may need some of these benefits, that's when it becomes restrictive.
Yes.
Okay. So now I know there's a lot of myths and misconceptions out there, and a lot of people think that, protecting your assets is illegal. Is that accurate?
No, it's not illegal. If you kind of compare it to the tax code where people use different deductions and so on, there are rules within the Medicaid and Medi-Cal, being California's Medicaid program, where they have guidelines and allow certain things to happen. A lot of times people don't know this until they go to an attorney or they go to somebody who knows what they're doing, such as I do, says this is what you can do. Now, I don't recommend somebody with $1 million trying to apply for Medi-Cal. The reason is you're giving a bunch of money away. Number one, you're giving somebody control of your money, and you can invest that money wisely, and just the interest from that money can get you very comfortable care without using taxpayer benefits. But if it's something, I did have a client who had almost $1 million, but his mom has been on a respirator for 5 years now, and that's $22,000 a month. And so for that reason, I did agree to help him qualify his mom.
Well, yeah, because with the cost of medical care, $1 million really doesn't go that far these days. I mean, it can be usurped rather quickly.
Right. But if it's just care costs, I look at the individual clients and I say, okay, this is what I think. I think you can go and invest this money better and be able to get into a very nice place and live off the interest and not dip into your principal.
So,
if you can do that, the income that comes in every month plus the interest and everything, if that's doable, yeah, definitely do that. Why have the government asking questions every year on your money if you don't even need those benefits? But for other people, let's say you have $300,000. I would rather gift that money, have that money used for the care and comfort of the person or the married couple.
Or put it in a trust,
so that they
correct?
can find a place and live there throughout their life and have no worries that they will ever have to move.
Or they can put it in a trust. It doesn't always have to be gifted, correct?
Well, if it's put in a trust, it's usually gifted first and then put in a trust.
I see. Okay. So now I understand that I've heard the state will lien your home for reimbursement and that there's a look-back period. So can you tell us a little bit about that?
Yeah, the house is an exempt asset, which means they can qualify for Medi-Cal with a house and they can qualify for Medi-Cal without a house. So there is this little thing in the guidelines that says that if you give your property away to qualify for benefits, it'll make you ineligible. But if you give your house away, then you're not giving it away to qualify because you'd qualify if you kept it. So you can give away an exempt asset, that includes a car or whatever, and still qualify for benefits. Medi-Cal is going to go after anything that you own at the time you pass on or the last spouse dies if you are getting Medi-Cal benefits. But if you do not have any property, they're not going to go after what you've already given away.
So yeah,
why
would somebody want to
a look back? In California right now, it's 30 months, and it will go to 5 years when they are planning on changing the law. But right now, an exempt asset can be gifted away without any ineligibility.
And without the look back?
It satisfies the look back. They're still looking back. So if somebody is filling out an application, they say, did you give your property away in the last 3.5 years? You say yes. But if it's an exempt asset, it's a house you lived in, and it was exempt at the time you gave it away, then it's not going to disqualify.
What do you mean if it's exempt at the time?
A primary residence is exempt. So let's say they have a house in Arizona.
So if it's exempt, why do they have to give it away?
Okay, that's one of the options. Okay, there's different options for a house. If you live in the house at least two of the last 5 years, then you're eligible for a $250,000 capital gains exemption. For a married couple, that's times 2, so that's $500,000. So if you give the house away, that might be something you need to think about. Am I giving away my capital gains exemption? So if you give it away and then to your daughter, and then your daughter puts it on the market, and then now you owe capital gains tax. You may want to put it on the market before, and this is, again, what I talk to my individual clients about. There are so many different things I have to think about when I give them advice. I notice that a lot of attorneys will say, okay, you got to give the house away right away, and then that exempts it, but are they causing a taxable event? So it can also go into an irrevocable trust. There is also an intentionally defective irrevocable grantor's trust that some attorneys do. It's expensive, but it allows you to give the house away and rent it out and get the income without it adding to your income. So depending on what you want the house for? Do you want the house to work for you? Do you want the house just to go to your heirs at this time? The taxes and everything have to be considered. That's where I'm going to be directing them based on their individual situation.
Now, I know a lot of people don't like the idea of giving their house away. When you say gifting it and giving it away, they're not really giving it away. They're just repositioning that asset, correct?
In some cases, yes. In some cases, no. Depending on what they want to do. You know, I've only had one client that's had recovery against them, and the reason is she wanted to have her house. She was in a skilled nursing facility, and she would not let her daughter sell the house or do anything. So her daughter continued to pay the taxes and the upkeep and everything else, and she ended up being recovered against at the time she passed on.
So the proceeds from the house went to the skilled nursing facility?
They went to Medi-Cal to reimburse what Medi-Cal paid to this facility.
Okay, so that probably wasn't the wisest choice for her to make, but obviously people have a right to make unwise choices, correct?
Right.
But that's what you do, is to try and help people make better choices and to preserve their assets and protect them so that they can be passed on to their children, and so that they're not paying the burden of when it gets time for their care, they will have some resources as well, correct?
Correct.
Okay.
Yeah, two people could have identical situations financially with the house and everything, and one could feel one way about something and one could feel a different way about something and have two different outcomes. So there's a lot to be considered in what I do, and that's how I ask questions. Going back to the reverse mortgage, it could be a really bad idea for one person and a really good idea for another. Same exact situation, but one will say, oh, I absolutely want to stay in my house, and another one will say, I absolutely want my kids to have my house.
Okay. So why is it that a lot of seniors haven't heard of these entitlement benefits that are out there?
You cannot call anybody and get this information. It's just not available. If you call Medi-Cal, they will not spend the time with you on the phone. They'll tell you fill out an application and go through the eligibility process. What they get is an approval or a denial. They can go online and they'll get some information, but basically it's someone saying, I'm going to give you some information, then you got to pay me to get the rest of it. When people call me, I give them a lot of information. I tell them, look, get a pen and a paper. I'm going to tell you what you need to know. I'm going to tell you how this is going to benefit you and what needs to be done to apply. And then I'll honestly tell them, look, you can possibly go on your own and apply. I used to tell that to more people than I am today because Medi-Cal is cutting back on staff, and there's just too many denials coming out that are in error. So I can't really say I recommend anybody applying on their own anymore, but I do say you can apply. Nothing needs to be done to your assets at this time.
For some cases.
Yeah. I mean, I just got a case, just came in the door last month, and she got a denial going all the way back to November 2012. And I was able to get all of that approved, going backwards. Okay. So it was a wrongful denial. I was working with a worker, and she says, I don't know how this got denied. I just don't understand it.
Okay. So can you give us an idea what some of your fees are to help people with this process?
Yeah, my regular fee, okay, this is just for a regular case, is $1,000 for the first year. And basically, I will do the paperwork for the application and get the case all the way through. If I have to do a hearing, whatever it takes, there's no additional fee. If there's a lot of accounts that need to be repositioned, there's Edward Jones and Charles Schwab and bonds and this and that and whatever, I will double the fee to $2,000. It is literally a lot more work because I have to follow the trail all the way down. The money has to be gifted properly and so on. After we get the approval, there's a redetermination every year, and I charge $100 a year. So basically, once somebody pays the initial fee and they continue to pay the annual fee, they're able to call me up and say, our health insurance premium changed. What do we do? Or can I drop my insurance? Or can I do this? Or whatever. And I'm the one that's going to notify Medi-Cal. So I talk to Medi-Cal and then talk to my clients. And then my clients talk to me and I talk to Medi-Cal.
Okay.
Yeah, so they do not deal with Medi-Cal whatsoever. They would be working directly with me.
Okay, and do you see Obamacare affecting any of these entitlement programs?
I did speak with a worker that I have been dealing with for many, many years up there. She says, yeah, we just had some training on the Obamacare thing, and she said it's not going to change the care part of it. It's going to be more for younger people that usually didn't qualify for benefits, or if you're 65, older, or disabled, then it's a whole different program. It's not going to be the Obamacare program for them.
Okay. All right. Well, I want to thank you, Carol, for joining us today and giving us all the insight and wisdom that you have regarding these entitlement programs. And you're an awesome resource for seniors, and I would highly recommend that our listeners and readers take advantage of your service. Can you tell us your contact information so that they can get a hold of you if they would like to use your services?
Yes, and I just want to say that I was in Sacramento until 2.5 years ago. We've located to San Diego, but all of our clients we deal with over the phone, through mail, email, and fax, and it's worked out very well. We have clients in 27 counties, and our phone number is 888-413-3113, and our website is thelightforseniors.org.
Okay, and this is Teresa Johnson with Senior Care of Sacramento. If you need help with finding in-home health care or assisted living, residential care facilities, and board and cares, that's what we specialize in, as well as we can help you with referrals to VA representatives and people like Carol. So our number is 530-305-8872. And again, if you would like to call Carol and use the Light for Seniors services to get set up and find out if you're eligible for Medi-Cal or Medicare or do some asset protection, her number again is 888-413-3113. 3113.